know the famous line,
"I've fallen and I can't get up."
Luckily, medical alert systems have come a long way since. And thanks to advances in GPS tracking, voice activation, and mobile apps, seniors are able to live independently at home for longer. Today, I'm talking to Kathy Habis, who is a staff writer on SafeWise. She recently reviewed AlloCare Health, a medical alert system with Alexa-like qualities designed to give caregivers peace of mind and seniors more independence at home.
My name is Kathy Habis, and I'm a staff writer for SafeWise.com, and I focus on family safety. Family safety encompasses best smartwatches for kids, medical alerts for seniors, just in general how to keep your home safe if you've got toddlers or babies or aging parents. A medical alert system is a really quick way to get help from 911, but instead of putting you directly in contact with 911, you talk to a professional monitor first, and they have all of your health information on file. They have your location. If you use a mobile GPS unit like this, they'll have your location pinpointed, and they relay all of that information to 911.
Equipment from AlloCare lands between $100 and $300. Its packages range from a simple wearable GPS unit with a call button and a speaker to a whole suite of motion sensors with a wall-mounted fall detector. Depending on the devices you or your loved one needs, monitoring fees can range between $25 and $50 a month. Just like a home security system, medical alerts use monitoring professionals to check in when they've been alerted to an emergency, like someone falling in the bathroom. You can find Kathy's full review on AlloCare on SafeWise.com. But first, let's hear from her about her testing experience.
AlloCare comes with a base station for in the home, which most systems do. It's got this big button that you push when you need help.
The kit Kathy tested included a base station, a mobile companion GPS unit, and a wearable button. This setup is pretty standard for medical alert systems. Most come with at least a GPS button that lets caregivers call their loved ones or wearers call for help when they're away from home.
Well, I was very curious about how accurate it was going to be with the voice activation, and I went through the full setup process. So I got it out of the box, plugged it in. How's this going to set up? I have difficulty with devices wanting to connect to my Wi-Fi, so I was a little bit skeptical that this was going to work. I didn't have to put in any password or anything to use this hub. I believe it just connected to my cellular network, so that was really nice. And it took, I want to say it was less than 3 minutes, but it was just 3 minutes of me standing there and waiting for the device to kind of finish thinking.
After setting up her base station, she ran a few tests with her system, including pairing it with her Amazon Echo, performing a test call, and maybe the most eye-opening, what she called the bathroom test.
Okay, now I'm gonna go from the kitchen to the bathroom and try to use the voice activation. Emergency! Emergency!
It's voice activated, so you can call the emergency center by using your voice. You have to say emergency 4 or 5 times in succession. And not only do you have to say it, but the system has to recognize that you say it. So sometimes you can end up saying emergency multiple times, up to like 10 times, and then you can get a little bit flustered.
Despite yelling for the AlloCare base station loud and repeatedly, she had trouble getting its attention. Good thing her dogs were there to help.
I do not consider myself a shouter. Like, I don't have that loud of a voice. This hub cannot hear me, and I'm literally one room over. And I'm thinking, okay, most older people probably don't have the loudest voices either.
And that's a biggie. A weak microphone in the base station means that calling for help from far away won't be as easy. Thankfully, Kathy's AlloCare kit came with a wearable button that she was able to test without shouting. So after all of this testing, what did Kathy think about AloCare? Don't get the wrong impression from Kathy's bathroom test. She did walk away from her experience with a lot of good to say about this medical alert system. First, she was able to easily cancel any false alarms, which is especially useful during testing.
One thing I like about it is that it's really easy to cancel if you accidentally have a false alarm, like if the grandkids are like, hey, what's that button? Or you just press it on accident, or you decide, you know what, I don't really need help. I'm gonna call somebody instead of talking to the professionals. I'm gonna call a family member.
It also makes it easier for users to call family and caregivers through the device itself.
The check mark and the X are for accepting calls from caregivers. So they can actually, through the app, do a check-in call, and the button, the light around the button will glow and let you know that someone's calling in. And if you don't answer, the call is put through automatically. But if you really do not want to talk to somebody, you just hit the X button and say, I don't want to talk.
Okay.
Next, she enjoyed the AloCare mobile app, especially for folks watching older loved ones with onset dementia or memory issues.
And I have to say, I really was impressed with the app for this, because it shows you not only street view, but satellite view. And you can export their location into Google Maps, Apple Maps, and get directions to their location, which other medical alert devices like this that I've tested don't let you do anything like that.
And finally, the system's GPS unit, or mobile companion, was a hit.
I wanted to talk about the GPS capabilities of the mobile companion, because I was really impressed by this. If you have a loved one who maybe is just starting to show some of the warning signs of dementia and they just get confused, they're still able to live their normal life, but maybe they go out for groceries and they get in the car and they're like, I don't remember how to get home. Like if they push the button only goes to the professional monitoring center, but caregivers have a way of tracking location too.
As you saw from Kathy's footage, the microphone in the AloCare base station wasn't able to pick up Kathy's voice from the next room over. That's not a great sign.
Emergency! 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 Emergency!
But that wasn't the only gripe our tester had with this system.
How long did the backup battery last?
It only lasts 6 hours, which is not great for the medical alert industry. A lot of them last 32 hours. So this is really only good for, we're just kind of cleaning up the house, we're reorganizing things, and we had to unplug the hub and move it, and now we're going to plug it back in really soon. Or there's a planned power outage on the street. Don't worry, Mom, your system will still work.
Compared to other medical alert systems, a 6-hour backup battery is pretty puny. She tested others that claimed to last on reserve for at least 24 hours. This is especially helpful for folks who live alone. If the power goes out and they have an accident, a system with a functional backup battery can still get help. So we've gone through Kathy's testing process, what she liked and what she didn't about AloCare. So who's this system for anyway? And would Kathy recommend it?
And I would recommend AloCare to people who really want to keep track of their loved one's location, their just activity around the house. The caregiver app tells you stuff like when your loved one last walked past the hub. There's motion detectors on the hub, and it will tell you, oh, so-and-so was last seen, 1 minute ago in the kitchen. So I really, really like it for caregivers. I think it's really robust. It's got a lot of features. You just have to find a system that you feel comfortable with. So even though I'm really impressed with AloCare, if you are more comfortable with another system, that's fine. just get something that you're comfortable with. And just the important thing is just to have one. If you feel like you need one, or if even a caregiver thinks that you need one, just go ahead and get one.
Learn more about AloeCare from Kathy's full review on Safewise.com. You can also find lists of our favorite medical alert systems along with the best for fall detection and the most affordable. And don't forget to like and subscribe for more product testing here on YouTube. Thanks for watching and stay safe.